Hello, everyone. Welcome to Leaving on a Jet Plane, How to Protect Your Patients When They Travel. I am Heidi Gurov, the Clinical Consultant and Quality Improvement Specialist for the Wyoming Department of Health Immunization Unit. And I am so excited to share this topic with you. Travel medicine is one of my favorite things ever, and I love traveling, so perfect combination. I also think this is a very timely topic to discuss, even though in many places we are unable to travel, especially internationally at this time. I think we have definitely all been shown how travel medicine can definitely impact the world and that we are a global community. So hopefully this information is timely and then also will be in your brain for when things resume to our new normal and we're once again able to travel domestically and internationally. So just a quick overview, we're going to discuss why this topic is important. Like I said, I think we've been shown recently why this is an important topic. We'll talk about the components of the pre-travel consultation, talk about travel vaccines, which include routine vaccines you're probably familiar with in your everyday world working with immunizations, also travel vaccines. We'll discuss how to handle those pesky last-minute travelers, and then I'll share some resources with you. So I just want to open up with this quote from the CDC, and it is, "Travelers are an epidemiologically important population because of their mobility, their potential for exposure to diseases outside their home country, and the possibility that they may serve as a conduit for disease from one country to another." This kind of forms the basis of why we should care so much about travel vaccines and medicine. So why is this important? First off, we are a global world, a global community. It's a little bit different than it was back in the day where it was a lot harder to travel and you were maybe isolated if you were a very specific country. And that's really changed in the last several decades where we're all connected, whether it's through commerce or education, friends and family who are living internationally, vacationing, all of that. We have seen definitely an increased amount of travel. We know there's more opportunities for international flights leaving from most places. It used to be in the United States, you had to fly from one like New York or California, one of the coasts to get internationally. Now we see direct international flights that leave from the middle of the country, including Salt Lake City and Denver. It connects us a lot more. We've seen budget airlines and cheaper airfares that make international travel more affordable for more people. We've seen other areas of the world with increased travel because their citizens are able to leave more. This is like an example in China where their government now is more encouraging of international travel and leaving their borders, which leads to higher tourism numbers from those countries. We also see increased travel just based on kind of that whole, it's better to collect memories versus things, and people are emphasizing experiences and seeing the world more. This is also important because of emerging pathogens. Up in the upper right-hand corner, you will see a picture of the SARS coronavirus 2 or COVID-19. This is an emerging pathogen that has definitely impacted our lives greatly in this year. And we've also seen like HIV emerged in the late 1970s, early 1980s, obviously massive global impact. We've seen the hemorrhagic fever viruses like Ebola emerge, different strains of the flu. So there's a lot of viruses, bacteria, and other pathogens out there that are new to us that we're coming in more contact with. This is also important because of things like climate change. As different areas of the world warm, we might see different pathogens emerge. We might even see pathogens re-emerging from animals that were frozen in permafrost that is now melting. There has been cases of anthrax where people have stumbled across a reindeer that was frozen for who knows how long in permafrost, and the anthrax spores, they were able to breathe them in and come down with anthrax. So something to consider. We're seeing changing habitats where humans are now coming in contact with different animal species that they might have not contacted before. And we're seeing viruses jump from those animals into humans. COVID-19 is a great example of this. They believe it was a bat virus that was able to jump into humans. Then we see things like antibiotic resistance. So bacteria have been able to evolve resistance to a lot of the medications that we have developed to kill them off and treat them. And we're seeing more and more resistance as antibiotics have been overused by humans, and this has led to the emergence of things like MRSA, methicillin-resistant Staphylococcus aureus, vancomycin-resistant Staph aureus, and other things. And these strains can travel around the world. Another reason why this is important is that many diseases that are rarely or never seen in the United States are still common worldwide. Sometimes we have that first world privilege in the United States where we don't see things like polio or diphtheria, and there might be this perception that these diseases no longer exist. And we know this is not true. In fact, in 2019, there was 173 cases of polio worldwide. In comparison, there was only 33 cases in 2018. So we've actually seen an increase in polio. This is a disease that some people think have been eradicated, and it hasn't. So diseases like tetanus can be very common in the developing world, and they really lack that healthcare infrastructure to help treat it. Rubella, which has huge complications in the unborn and newborn babies. Common diphtheria, that is one of the diseases they worry about is going to reemerge as our vaccination coverage drops due to the current pandemic we're experiencing. Polio is still out there, especially in Afghanistan and Pakistan. Hepatitis, especially hepatitis B, is very endemic or very common in many areas of the world. And then measles. This is something that touched us greatly last year, where we saw a reemergence of measles in the United States. We also almost saw our elimination status get revoked. So definitely we might not experience these every day, but they are in other corners of the world. They're very accessible through travel. So the scope of travel, in 2017, there was 1.33 billion worldwide international tourist arrivals. For US residents specifically, they made 88 million trips with at least one night spent outside of the United States. And then some other things, we talk about international travel, but even domestic travel. So for here in Wyoming in 2018, we saw 8.9 million overnight visits to the state of Wyoming. Remember, we only have a population of, I think, a little under 600,000. So to imagine 8.9 million is kind of crazy. We see 4 million visitors annually to Yellowstone. Actually, in fact, every year Yellowstone's traffic and visitors increase. It's one of the most popular national parks in the world. So that's 8 times the population of Wyoming alone that is coming into Yellowstone every single year. And there are many different reasons people travel. It's not always just for vacation. So we have tourism, which would be your vacation, seeing other parts of the world. We have people who have to travel for business. I travel a lot, even in my current position, for like conferences and stuff, and it's part of work. There's people who choose to study abroad, whether they're exchange students in high school or in college, they, do a semester abroad or choose to attend a foreign university. People travel for research purposes. We see like people who do research on different diseases or cultures or anything, they might have to travel outside where they live. People travel to visit friends and family who might live elsewhere. There's people who perform mission work. This could be medical missions, humanitarian relief, also religious purposes. We can see international disaster response. So if there's like an earthquake or a tsunami somewhere, people will choose to be part of that response and go help out. And we also see people traveling for medical care. We know medical care is very expensive in the United States, sometimes even with insurance. And there are procedures that can be received for far less money internationally. This is called medical tourism, and it is something that happens. Sometimes people travel to Mexico or Southeast Asia for like bariatric surgery, cosmetic procedures, stuff like that. Now we're going to start talking about the pre-travel consultation, also known as you're going where and doing what. So the pre-travel consult, a big part of this is you need to routinely ask about travel for all patients during all encounters. Travel vaccines and consults are just not for traveling to, and as I said, insert your favorite developing nation here. I think sometimes there's this perception that travel medicine is for those going to Africa, which really you need to consider even travel to standard places like Mexico and Europe. There's a lot of travel vaccine recommendations for places like Mexico and even areas of Europe. Sometimes we think that, you know, European countries are kind of like us, there's nothing special we need to consider, and that isn't true. So gotta kind of really change that mindset that it's not just about developing nations, it's not just about Africa, but consider travel regardless of where the person's going, and making that part of the routine clinic workflow for like annual physicals and appointments of, hey, are you going anywhere, you know, cool? Have you traveled recently, etc. And then thanks to the 2019 measles outbreak, we really saw attention brought to domestic travel as well, where people are considering like, hey, I'm traveling to Washington State. I know they have a lot of measles cases. What do I need to do to protect my children and myself during this time? Once again, it's not always just thinking about international travel, but sometimes domestically as well. Only about 41% of adults who travel receive a pre-travel consultation, and this number is actually even lower for those who are visiting friends and family, with only about 18% receiving that consult. Sometimes when people are going for friends and family, they let their guard down more than like a standard tourist might. So it's important, like I said, make sure all patients are receiving this pre-travel consult. So different components. Probably the biggest first initial step is the risk assessment for the traveler, such as the trip details and the health background. So where are you going? What are you doing? What is your health status? Another component will be communicating the risks that person might have, and then providing risk management measures, such as immunizations, medications, and educational materials. So for trip details, first off, you're going to want to review the itinerary. You're going to want to look at countries and specific regions, because sometimes it's not just about the country as a whole, but specific areas they might be going. You'll want to include the order of countries if visiting more than one, including layovers. This layover piece can be important when assessing for the need for yellow fever vaccination, which we will discuss in a moment. But yeah, making sure you're not just talking about the end destination, but any places that might come in between. We know layovers are often needed, especially for very long distance international travel. You'll also want to know if they're, you know, rural areas, urban areas, like what that itinerary is detailing. You want to know timing. So how long that trip is going to be. Are they going for 2 days or are they going for 2 months? The season of travel can be important for certain diseases. You'll want to remember that in the Southern Hemisphere, the seasons are flipped. So like right now, they are going into winter in Australia and South America, whereas we're going into summer. And then you'll also want to consider the time to departure. So ideally, a pre-travel consult should take place at least 1 month in advance of travel. We know sometimes people have to travel on an emergency basis or very short notice, or maybe they're just really bad planners and wait till the last minute. But we'll discuss this a little bit later when we talk about last minute travel, but how much time there is until they actually leave can be important on knowing what interventions you can perform. So for the trip details, you really want to consider the reason for travel, because their reason for travel can kind of affect what interventions they might need or education. So, you know, are they going for tourism? Are they going for business reasons? Are they visiting friends and family? Heritage travel is actually something that's been fairly new in the past several years, with kind of the popularity of things like Ancestry DNA and 23andMe, where people are doing DNA testing to find out their ethnic and like heritage background. People are choosing to travel to those areas of the world to kind of see like where their ancestors came from. So something new to consider, kind of a new thing that's gotten a lot more popular in the last few years. People want to be traveling for volunteer, missionary, or aid work, research or education, adventure traveling, pilgrimages for religious reasons, adoption, or seeking health care such as medical tourism. You'll want to consider their travel style. So are they independent travelers or are they in a packaged tour? So if you're independent, like whether you're travel solo or maybe with your spouse or partner or a close group of friends, that's a lot different than being in a packaged tour where you might be on a tour bus with 50 people from all over the United States or all over the world and kind of mixing. Sometimes independent travel will be called self-catered or like a self-drive tour. So you might hear different terminology. That can definitely have different implications. You know, if you're out by yourself, you might not be exposed as much as someone on a tour bus or on a cruise ship, something like that. You also want to consider the likelihood of adventurous eating. So is this person more likely to seek out the food they're used to eating at home? Like they're going to be finding that McDonald's or KFC that is in that foreign country because it's the food they're used to eating. Or are they going to be going to like those animal markets or street vendors and eating deep fried bumblebees or something, you know, or animals that we might not consume here at home in the US? Are they willing to try that? That definitely changes your risk for foodborne illness quite a bit. Also, the traveler risk tolerance. Some people are going to be a lot more weary of taking risks while traveling, where there might be other people who are like, heck yeah, let's go for it. Let's do all this crazy stuff. So once again, different things to consider. General hygiene standards at the destination. You know, is there access to clean water, running water, toilet facilities, hand washing? All those sort of things can definitely change. Modes of transportation, you know, is someone renting a car, or are they going to be on a tour bus, or are they hoping to hitchhike around the country? That definitely can put you in different situations and different risks for diseases. And then the accommodation at the destination. Is this traveler going to be staying at a 5-star modern equipped hotel, or are they going to be backpacking and, you know, staying in a tent where they might not have access to, you know, ways to wash their hands or different hygiene stuff? Or are they living out of a camper van? It all kind of changes their risk for certain things. Finally, the last thing for trip details is just considering any special activities these travelers will be a part of. So they can be a part of disaster relief, where they might be volunteering in an area that just had a devastating earthquake. So there's infrastructure breakdown of like healthcare and, you know, the government structure and all of that. Are they providing or receiving medical care? Are they going to be at high altitude? One thing that's always hard for me to wrap my head around as a Wyoming native is remembering that we live at a high altitude here in Wyoming, and where I don't necessarily think 6,000 feet is high elevation. Someone coming from sea level, that can actually really impact their health. So considering where they're traveling to and if they're acclimated to being at that elevation, and kind of remembering our own biases towards what we consider high elevation, because I know I don't consider anything high altitude until about 13,000 feet, and that's completely different if you are from sea level or somewhere lower. Are they going to be diving? We know scuba diving has all sorts of risks, like how fast you can ascend and stuff like that. Cruise ships, we know cruise ships can sometimes be floating petri dishes of all sorts of things, you know, norovirus outbreaks, COVID-19 and stuff. Once again, you're in contact with a lot of other people with like buffets, stuff like that to consider. Are they going to be rafting or have other water exposure? Are they cycling? Are they taking up mountain biking through the jungles of Vietnam? Definitely some risks there. Extreme sports. Spelunking, so if you're going into caves, what lives in caves? Bats. And, you know, just the risks that go along with being around bats, like rabies and other diseases, possibly novel viruses. Are people having any anticipated interactions with animals? and then any anticipated sexual encounters. So next you want to consider the health background of the person who is traveling. So past medical history, their age. We know the young and the old are both at higher risks for most infectious diseases as a generalization. So considering, are they traveling with young children, infants? Are they traveling with someone who might be considered elderly? The sex of the patient, whether male or female, any underlying conditions, do they have diabetes? Do they have heart conditions? Do they have respiratory conditions? Immunocompromising conditions? Do they have any allergies? This is not only allergies to medications, but also allergies to food or even environmental allergies, and then medications. What medications they're on, if they're going to have access to these, if they need a supply of the medication to last through their trip. And then also like making sure they have everything in place that they can travel with their insulin needles and syringes and stuff like that on like a commercial airplane. So special health conditions can include pregnancy. This definitely includes the trimester. Many commercial airlines have restrictions on how far into pregnancy that you can travel. Obviously, they really discourage you traveling if you're like on your due date, because you don't want to deliver a baby at 35,000 feet. Breastfeeding and kind of all that might go along with that. Are you going to have access to clean water to clean, bottles if you pump and put it in bottles, stuff like that. Any disabilities or handicaps, like where you're going, do they have kind of those disability features in place that you can get around in your wheelchair or accommodations like that? Remember, not everyone has the handicap accommodations that we have here in the United States. Do they have any immunocompromising conditions or on any medications? Older age, psychiatric conditions. Travel can be a stressful experience, even if it's supposed to be this like nice tropical vacation. There's still stresses that happen when traveling, and is that gonna possibly trigger or aggravate any psychiatric conditions the person already has? Seizure disorders, if they've had recent surgery or recent cardiopulmonary events. A history of Guillain-Barré syndrome, and then any severe allergies that might make sure you need to be able to manage those when traveling. You want to consider the immunization history of the person. This includes routine vaccinations and also travel vaccines. And then any prior travel experience. Like, is this someone that is a very savvy international traveler and they've been to all 7 continents and 100 countries and this is kind of routine for them? Or is this someone's first time ever traveling and they're maybe a little bit more naive and scared? Do they have experience with taking malaria chemoprophylaxis in the past? Do they have experience with being at high altitude? And have they ever had any prior illnesses related to travel? So after you assess the trip details and the health background, you'll want to communicate the risk to the traveler. So this is a two-way exchange of information between the clinician and traveler. You're going to want to discuss any potential health hazards at the destination or destinations and the effectiveness of the preventative measures that the person can take. The traveler's perception of intolerance for risk can vary very widely. So there's the saying of like, there might be something like 1 in a million travelers will get something. And then some people go, well, there's no need to worry. I'm not going to be 1 in a million. But then there will be others that'll go, yeah, that one person, that 1 out of a million is going to be me. So everyone kind of handles their risk differently, and that's something you want to assess, because there might be someone that's, oh, no worries, I'm not worried about that. And there's might be someone like, give me every vaccine that exists, every medication, because I'm going to get it if I don't do this. So people differ in those aspects. So finally, you're going to want to manage the risk. So you'll want to administer any vaccines that are recommended. You're going to want to prescribe malaria prophylaxis and educate the person on how they need to take that. You'll want to instruct that traveler to bring any copies of medical records. If they have, let's say they've had a cardiopulmonary event kind of fairly recently. It might be helpful to travel with some records in case something happens. They have proof of like maybe any procedures or, you know, something happens that could help any healthcare professionals that are assessing them or treating them. You're going to want to plan for treatment and mitigation of conditions like asthma. So making sure the traveler's traveling with all their inhalers and medications and are still, you know, taking any special considerations in place, like whether they have to, you know, maybe add another inhaler while they travel. You want to recommend that they obtain travel insurance. So most commercial US insurance policies do not work outside of the United States. Also, same thing with Medicare, not necessarily, you can't bill Medicare from another country. So what travel insurance is, it can have several, there's different companies that offer this, and it can have several different components. Usually a component of it is where they will reimburse you for any healthcare expenses obtained in that foreign country. They don't necessarily pay up front, but they will help you reimburse bills. It can also include things like medical evacuations. So let's say you got sick internationally and you need to get back to the United States to receive the level of care. Often these policies will pay for the flight or whatever has to happen to get you back to your home country. They can also include things like, you know, if there's any accidents, dismemberment, also bringing back any remains should someone happen to pass while traveling to help get, you know, whether it's the ashes or the body back to their home country. Travel insurance can also include things like trip cancellation, like you had this great vacation planned and then a pandemic happened and your flights and hotels and everything, you know, help kind of reimburse those costs if you have to cancel the trip. Also things like lost baggage and stuff. So there's a lot of parts to travel insurance, and people can kind of select the policies that work for them. I do caution if anyone's doing anything like mountain climbing, even stuff like bicycle tours, backpacking, hiking, making sure that the policy will cover them if they're doing certain activities like that is also key to find out. There is people that do talk about like they're able to, once they're back in the United States, submit any healthcare costs to their United States insurance. But once again, that's going to be once you're at home and you're going to be responsible for paying those medical bills to that country while you're there and then submitting for reimbursement. So something to consider. You have to remember, like European countries have universal healthcare. They cannot bill your United States insurance. They don't know what billing insurance means. So you'll want to instruct people on how to find reputable medical facilities in their destination, you know, maybe in advance of travel, knowing like where the hospitals are, where they can go to seek care. Making sure people have any medical ID, jewelry, or cards they may need to have to alert of medical conditions. So, you know, the medical bracelets that say, hey, I have diabetes, or these are my allergies, making sure they have them and they're wearing them. And then carrying with them translations of allergies into the local language. This is kind of a personal Heidi tip. So I know personally, I have a anaphylactic food allergy to tree nuts, or like walnuts, hazelnut, etc. Before I traveled to Iceland for the first time, I had an Icelander translate all the nuts from English into Icelandic for me, so I could learn the word in Icelandic and then be able to communicate that. I was doing a lot of, I grocery shopped when I was there, so it was nice for me to check food labels in case the food label wasn't in English, because they're not always. I was able to make sure there was no hidden hazelnuts or anything in there. So that's something kind of a personal recommendation, but I think it's incredibly helpful for if you have certain things, kind of making sure you have the translations into that local language. Because as much as English is very prevalent in many parts of the world, you'll always run into someone that maybe might not know it as well, or, you know, they might not know what a certain allergy is in, you know, English. So personal tip right there that I've learned through traveling. So finally, for travel vaccinations, there are some considerations to take in place as you're recommending these to patients. So is there significant time before travel to complete a vaccine series? Some important when you have those last minute travelers, but you know, you look at hepatitis A vaccine, that is a 6-month dosing regimen. And That's a long time out to really be taking those considerations in place. You'll want to pay attention to vaccines for which immunity may have waned over time. So what we think of is like TD or Tdap, especially many adults don't necessarily keep on getting their tetanus shots every 10 years, like recommending or as recommended. So you'll want to kind of look at any of those routine vaccines that might need an updated booster. We'll look at any recent immunocompromising conditions, such as, have they had a hematopoietic stem cell transplant recently? Are they on chemotherapy? This can change what vaccines they can receive, but also maybe like with stem cell transplants, a lot of times an adult has to redo like their polio, their Hib, pneumococcal, a lot of those more childhood vaccines again. Future travel plans in the next 1 to 2 years can help justify receiving certain vaccines. Some vaccines are very costly, such as rabies or Japanese encephalitis. But if the person has plans to travel repeatedly to areas that might have these vaccine recommendations, that can help justify the cost. And then consider insurance reimbursement and cost as well. So normally if this was a live session, I'd pause here and ask for audience questions, but since you're just listening to a recording of me, I am going to say, if you have any questions at any time about anything I'm discussing, please, please, please shoot me an email, or you can give me a phone call and I will help answer those questions for you. I really wanted to keep my question slides in here because I'm sharing my own travel photos from Iceland. If you haven't had a chance to listen to me go on and on about Iceland, now you're going to hear about it, but I wanted to share my really cool photos. So it's also a chance to give my contact information. Like I said, I always welcome questions and I'm here to help you out. So email or phone. This is a photo from the Icelandic Highlands in Landmannalaugar. It's a beautiful place. This is not Photoshop. This is what it looks like in real life. Amazing place. You should definitely travel there. So next up, we're going to talk about routine immunizations. So these are the vaccines we give it day in, day out to children, teenagers, adults, everyone in between. This is what we deal with all the time. And yes, they still play a role in travel. So it is recommended that all travelers are up to date with all routine immunizations for which they are eligible. Children, adults, everyone in between. This includes the annual flu shot. And I would say this is important regardless of where they're traveling. This, is travel within the United States. This is travel to halfway across the world. This is travel to the moon. Make sure they have this regardless of where they're going. So we're going to run down the list of all kind of the routine immunizations and the recommendations around them. So we'll start with Haemophilus influenzae type B, or Hib vaccine. So this organism is found everywhere. So there's no travel specific recommendation because it's everywhere. Everyone should always get these vaccines. For hepatitis B, this is especially recommended for travelers visiting countries where hepatitis B surface antigen prevalence is greater than 2%. So this means countries where more than 2% of the population have hepatitis B, whether it's acute or chronically. This includes Asia, Africa, South America, and the Caribbean. And this vaccine should also be considered for all travelers depending on their behavioral risk and potential for exposure as determined by the provider and the traveler. So those seeking medical or dental procedures. Hepatitis B virus is spread in blood. So if you're thinking about, medical procedures, definitely usually involves blood. Same with medical or dental procedures. So if you don't floss all the time, your gums might bleed a little bit. So, sometimes you might not be sure about the quality of sterilization of medical instruments and stuff like that, and infection control policies in other places. So making sure you're protected against bloodborne pathogens like hepatitis B, great idea if you're going to be having medical or dental procedures. Same thing, tattoos and piercing usually involves a bit of blood exchange, same thing. People might want a tattoo in memory of their trip they're taking. Acupuncture, and then also sex. So if they're kind of considering any of these activities while traveling, protecting themselves with hepatitis B vaccine, great idea. This is a map that shows hepatitis B virus prevalence in the world. As you can see, it's very high in Africa and Southeast Asia. And even, I think, some other, even European countries in there, like I think I see Romania is a little bit higher. So if you have people traveling different parts of the world, you can kind of use this map to help guide that recommendation. For HPV vaccine, we know this is a very prevalent virus. Nearly everyone gets it sometime in their life. Sexual activity during travel may lead to HPV infection. So once again, just making sure everyone's covered with this vaccine. Influenza. So because the southern hemisphere is on the bottom of the world and has flipped seasons, their flu season typically runs April through September, so opposite of our flu season. And then in tropical areas, they can actually see year-round transmission of flu. So important to make sure people have had a flu shot. Flu vaccine that we use here in the United States is good through June 30th of every year. That's the expiration date. And so if someone is planning on traveling in the summer months, you know, and you still have a flu vaccine, if you still have vaccine available, you know, it's sitting in your fridge in April, go ahead and give them a shot. Great idea. We do know that the southern hemisphere does get a different flu vaccine usually because they, you know, change the strains every year, but at least we'll give them some coverage. Usually they're matched up pretty well that, you know, they can have some protection. We do see outbreaks of flu occurring on cruise ships, so definitely want to protect those. And then we do see novel viruses that can be transmitted to travelers visiting areas with circulation of these viruses. So there are some like avian flu strains that, you know, don't occur in high numbers, but it might be possible to contract it if visiting like an area, let's say like China, that has a lot of close contact with poultry. So. Measles, mumps, and rubella, or the MMR. So there are some specific recommendations for this vaccine, mostly involving children. So infants 6 to 11 months old, they can actually receive 1 dose of MMR before travel. So we know MMR is routinely recommended at 12 months of age. So if an infant does receive it at 6 to 11 months, this does not count as the first dose, and they'll still need a dose at 12 months and then again at 4 to 6 years. For those who are 12 months or older with no evidence of immunity, you can give 2 doses of MMR given 28 days apart. So let's say you do have a 12-month-old and they receive those 2 doses. They're actually good. They don't need another dose at 4 to 6 years. So this can kind of be a little tricky if you run into this with looking at like kindergarten shot compliance. But they are able to get those 2 doses pretty much right away with a month apart to help protect them. If you have someone who's 12 months or older who have written documentation of 1 dose, you can give, once again, that 1 additional dose before travel, 28 days after the previous dose. So during the period of 2009 through 2014, 53% of non-immune MMR eligible travelers were not vaccinated during their pre-travel health consultation for MMR. So once again, I think sometimes you get really caught up on the yellow fever and the typhoid on those travel vaccines that we can overlook some of these routine immunizations like MMR. Obviously, we had a very large measles outbreak here in the United States. It was mostly spurred on by US citizens who had traveled internationally to countries with measles outbreaks, who then brought it back to their communities. So MMR is probably one of the most important routine vaccines to consider for travel, especially in young children. Measles can be a very serious disease. Mumps can have complications, and rubella, although rarely seen in the US, can have huge complications in pregnant women. So very important to make sure everyone is protected. Measles, we especially see a high burden of cases in Europe. So once again, considering all those places to travel that sometimes we don't. Here is the map. I'm sorry, this map is a little weird. The World Health Organization apparently thought Alaska and the west coast of the United States didn't need to be included in the map. But this kind of shows the 2019 measles cases worldwide. So you see there's a very high burden of disease in Europe, especially in Eastern Europe. And then of course, Africa and South America and parts of Asia. So remembering that measles is everywhere in the world, and just because we might not see a lot here, it can easily be brought back. Measles is probably one of the most infectious diseases in the world. It's very incredibly easy to get, and the virus itself has made it, it has some good methods to making sure it can get into a person and cause illness. So next up on our routine immunizations is meningococcal, specifically the ACWY vaccine, so your Menactrim and Veo. So there is a region of Africa and sub-Saharan Africa called the meningitis belt. The map on this slide kind of shows the areas it affects. During the dry season, they see very high epidemic risk of meningococcal, so travel to this area is usually recommended to receive the ACWY vaccine. Also for the Hajj pilgrimage in Saudi Arabia, they will not issue you a visa without receiving the meningococcal ACWY vaccine. I do talk a little bit more about these recommendations in my meningococcal 101 session that is also being recorded and sharing. So definitely check out that presentation if you want to know a bit more about meningococcal disease as a whole, and then a little bit about these travel recommendations. For pneumococcal, this is very similar to Hib, where the organism is found everywhere, so there's no travel-specific recommendation, except that this is something you should be routinely vaccinated for as a child because it's everywhere. Polio, as you've seen, we're actually seeing an increase in polio cases worldwide. For a while, it was kind of hopeful that polio would be eradicated, but 2019, we saw quite a spike from 33 cases to 173. And then now that COVID-19 has stopped many immunization campaigns across the world, we suspect polio cases are going to increase further. So a single lifetime booster dose for adults traveling to certain countries is recommended. And then unvaccinated travelers and those with unknown vaccination status should complete the entire routine series to protect themselves. And then polio travel recommendations can kind of differ depending just if there is circulation of wild or vaccine-derived polio virus in certain countries. Because this is ever changing, I always refer to checking out the CDC website, which I will talk about in the resource section of this presentation, to know which countries currently have a recommendation for entry and exit for polio vaccine, just because it's a very fluid situation. The rotavirus, this virus is very common in developing countries. So if you're traveling with a young infant who is under 8 months old, making sure that they are covered with rotavirus vaccine. For tetanus, diphtheria, and pertussis, it is recommended to have a booster every 10 years after the initial series in childhood. You can booster patients with Tdap or TD. This is a fairly new change by the ACIP and CDC that came in effect, I do believe, last fall. It used to be where you got one lifetime dose of Tdap and then TD thereafter, and now they've changed it that you can use Tdap for every booster or TD, whatever you have on hand. There have been rare cases of diphtheria associated with travel, usually in someone who had not been boosted. And then pertussis does occur in adult travelers as well who do not have a current booster vaccine. Also, I'd argue if they're doing any sort of hiking or anything that might put them at risk for injury, definitely always having a current tetanus shot is a good thing. That's even a good thing when you're working in your own garden at home, but especially if you're traveling. Tetanus is found in the soil. It's a disease that'll never be eradicated because it's everywhere in the environment. So make sure everyone's protected. For varicella, infections are very common in countries who do not routinely immunize against varicella. So the United States is kind of unique as we're one of the few countries in the world that has a varicella immunization program. Many countries in Europe do not vaccinate for varicella. So something to consider, making sure that yourself and any children are protected against varicella because it can be very common in other countries. And then with zoster, which we know is the varicella virus that's been dormant in your body, there's been no causal relationship with travel established, but we do know travel is a form of stress, and this may trigger a shingles outbreak. So if the patient is 50 years or older, encouraging them receiving the shingles vaccine is always a good idea. Like I said, travel can be a stressor, even if it's a happy, fun vacation. So I'll pause again for another fun question slide. This is Flatty Island in Iceland. So once again, shoot me an email or call if you have any questions. So now we are going to talk about travel vaccinations and the ones that are commonly used in the United States and a little bit of background about these diseases. So the first up is cholera. So cholera is a bacterial diarrheal illness caused by Vibrio cholera. It is spread through the fecal-oral transmission route, and it's usually spread through contaminated water, fish, and shellfish. And it's endemic primarily in Africa and Asia. So travelers who consistently observe safe food, water, sanitation, and hand washing recommendations while in countries affected by cholera have virtually no risk of acquiring cholera. So if you're making sure you are, drinking safe water, whether it's been boiled or bottled water, you're washing your hands after using the restroom before eating, all those good hand washing practices. You're also making sure you're eating food that hasn't been washed in uncleaned water, maybe sticking to fruits and vegetables that can be peeled, you're going to be good, mostly from cholera. There is a vaccine available. It's called Vaxchora. This is a single dose oral vaccine and it's licensed for adults 18 through 64 years. It is recommended for travelers to areas of active cholera transmission. So this can be a lot of times where this comes into play is like humanitarian or medical aid workers who might be responding to an area of an outbreak. I think of Haiti after their earthquake a few years back where they had a big cholera outbreak. And once again, when you have an earthquake, clean water, all of that gets disrupted. This is not necessarily routinely just because you're going to Africa, you need the cholera vaccine. That's not quite how it's recommended. You'll want to administer this vaccine at least 10 days before travel. And there's actually a recommendation for no food and water 60 minutes before or after the vaccine because it is an oral vaccine. This is a map that reports cholera deaths and imported cases in 2016. As you can see, it's kind of very specific areas of the world that have this active cholera going on. Looks like Haiti is one of them, Yemen, which has a refugee situation, some parts of Southeast Asia and Africa. So very specific indication for this vaccine. Next up is hepatitis A. I do kind of hate calling this a travel vaccine because it is a routine childhood vaccine. All children starting at 12 months of age should receive this vaccine in the United States. But we know for adults who are beyond childhood and it wasn't a recommended vaccine when we were kids, it is kind of considered more of a travel vaccine, which is why it's here. But so hepatitis A is a viral liver infection. It's also spread through the fecal-oral route, can spread person-to-person contact and also through contaminated food and water. It is common in areas with inadequate sanitation and limited access to clean water. It is endemic in parts of Africa, Asia, Central and South America, and Eastern Europe. All susceptible people traveling for any purpose, frequency, or duration to countries with high or intermediate endemic status should be vaccinated. We have seen cases of travel-related hepatitis A in travelers who have developed, they've gone to developed countries, developing countries, and even those with very standard itineraries, like they're not, they're staying in the hotels and eating clean food, etc. There have been cases. There are a couple of vaccines available. So we have Havrex and Vactech, which are the single antigen vaccines given at 0 and 6 months as a 2-dose series. And then there's Twinrix, which is hepatitis A and hepatitis B that is licensed in adults as a 3-dose series at 0, 1, and 6 months. So a couple different options. Once again, I just want to emphasize that this is a routine immunization for all children. Do not word it or consider it a travel vaccine for children. It's not, it's routine. And we do have cases of hepatitis A every single year in Wyoming, so this is something that's close to home as well. This is a map of where hepatitis A, where countries have moderate to high risk. You take a look at this, this is a good chunk of the world. So pretty much everywhere except the United States, Canada, Australia, New Zealand, and Western Europe, Scandinavia, we're about the only people who don't have a moderate to high risk. So if you look at this, we see the Caribbean highlighted, we see Mexico highlighted. Two very huge travel destinations that people don't often consider travel medicine consults for. Also, you know, Eastern Europe. So this is kind of one of those vaccines that pretty much every traveler should probably receive. And then once again, like I said, we have cases here in Wyoming, so it has benefits even close to home. Next up is Japanese encephalitis. So this is a viral infection that's transmitted through mosquito bites. It occurs through most of Asia and parts of the Western Pacific, but usually in rural agricultural areas. Humans are actually an accidental dead-end host for the virus. So when the virus gets into humans, it kind of just, that's the end of its life cycle. It's not spread person to person or anything like that. So we're not the ideal host for this. Japanese encephalitis does cause a very severe form of encephalitis, which is an infection of the brain. So this is a vaccine that itinerary review is very necessary before vaccination. So considering the travel location, the duration, activities, accommodations, and seasonal patterns of disease. So this is not a vaccine recommended for travelers with very low risk itineraries, such as they're doing short-term travel limited to urban areas or travel that occurs outside of the transmission season. So the ACIP recommends this vaccine for people who are moving to an endemic country. So, you know, they're going to be living there, which puts them at a way bigger risk than someone just visiting for a week. Travelers visiting for more than a month. Frequent travelers to endemic areas, like maybe they do a lot of business travel back and forth to that area. And then short-term travelers based on duration, season, location, activities, and accommodations. So if they're going to be mountain biking through the jungle and might not have mosquito nets with them, that's a high-risk itinerary. We do have one vaccine available in the US called Iaxaro. It's an inactivated IM injection licensed for those 2 months and older. The series does depend, sorry about that, the series does depend on the age at which they receive it. There's a different dosing schedule for those who are 2 months through 17 years old and 65 and older, and then those who are 18 through 64 years old. This is a map of the known risk areas. So this is a disease that affects primarily Southeast Asia. So you can refer to this map for those travelers. Next up is rabies. So rabies is a fatal viral infection. This is pretty much a universal fatal disease. I think there's been like maybe 2, 3 people that have survived a rabies infection, and it was with very, very, very high level ICU medical care here in the United States. It's transmitted through the saliva from the bite of a rabid animal. Key for this is that bat bites anywhere in the world are a cause of concern and an indication to consider prophylaxis. So if you think about people who might be going caving or spelunking or any contact with bats. The highest burden of disease is in India, and then worldwide we do see 59,000 deaths from rabies every year in humans. So, you know, we don't really ever hear of rabies so much in humans in the United States, but this is fairly common disease elsewhere in the world. So prevention, you'll really want to educate about the risks and the need to avoid bites from mammals in the travelers. So pet all the dogs, which is like this thing where everyone wants to, you know, say hi and pet every dog in the world because puppies and dogs are cute. This is not a smart idea to do outside of the United States. Canine rabies vaccination is not common in other parts of the world. People are not vaccinating their pets like we do in the US. Most places in the US have like a legal obligation that we vaccinate our pet dogs. So this is incredibly important that, yeah, that puppy might look cute on the street of wherever you're visiting, but do not approach it. You got to really restrain yourself here. And I'm saying that my goal is to pet every cat in the world, and I always have to remind myself, like, not every cat should be touched. So reminding people that vaccination of dogs, many dogs are stray in developing countries. They're not like our house pet dogs. And we really need to hold off on cuddling animals when we're not at home. There is pre-exposure vaccinations. There's 2 vaccine products available, Immovax and Ravavert. These are IM injections. They are given on a very specific schedule. This is not where you have wiggle room. You must give it on a 0-day, 7-day, and 21 or 28-day schedule. If you give it on day 8, you have to start all over. So like we know with most vaccines, there's some wiggle room and grace periods and stuff. You're not going to have that with rabies vaccination. It has to be on the schedule. Another way to prevent is also educating on how to obtain post-exposure prophylaxis after a bite occurs. So, how to get medical care, what to do. Vaccination is recommended for those traveling to endemic areas and are at risk, such as people who are veterinarians, who are animal control workers, who are going to be working with animals while traveling, cavers, and travelers to areas where immediate access to medical care is limited. Let's say very, very rural areas where they might not even be able to get like a medevac helicopter in there. Those things might not exist. The purchase of travel insurance that covers medical evacuation is highly recommended for everyone traveling to an area where risk of rabies is high. And this is because, let's say if you're bitten, they might not have the rabies immunoglobulin in the vaccine to give you. So being able to afford that emergency travel back to the United States where you can get those medications, that's where travel insurance can be very handy. So we're going to look at a map. This is where the risk of contacting humans contacting rabies is worldwide. As you see, it is a good chunk of the world. Asia, Africa, parts of Mexico that actually border the United States. If you look at the map, South America. The thing with rabies vaccination, it is incredibly expensive. I think it can run around $1,000 to about $1,200 for the series. So that can be unaffordable for many people. So making sure you just really educate on how to keep themselves safe, how to seek medical care, how to clean the wound, all of that, because this is a disease that you really don't want to mess around with, because if you actually develop rabies, it's pretty much a death sentence. And it is a very, very awful death. I used to show a video of someone with human rabies, but I disturbed too many people with it, so I've stopped sharing it. So you don't mess around with rabies. Next up is typhoid fever. So this is a bacterial illness caused by Salmonella enterica typhi. This is a little bit different than the Salmonella we worry about with baby chicks and eggs and stuff like that, but it is in the Salmonella family. It's spread through fecal oral transmission. It is a human-only disease, which means you don't have to worry about animals out there spreading it around. There's high-risk regions of the world, which includes Southeast Asia and Africa, especially India, Pakistan, and Bangladesh. Lower risk regions include South America, East Asia, and the Caribbean. Travelers staying with friends and families are at a higher risk than normal travelers. This is because people let down their guard when it's friends and family, preparing the food and water, etc. There's a couple available vaccines. The vaccines are not the most effective vaccines. They're only about 50 to 80% efficacy. So it's still very important to follow and educate people on following the proper food and water hygiene precautions that they can take. So there's an intramuscular injection called Typhim V. You can give this to 2-year-olds and up, and booster every 2 years if needed. Then there's Vivatif. This is an oral capsule series. So it's 4 capsules, one taken every other day at home. The traveler can store the medication in the refrigerator at home, no data logger needed, and take the medications, usually like you can get prescribed through a pharmacy. And this is a vaccine given to those 2 years and older, and you can booster every 5 years if needed with this vaccine. So another map that shows pretty much the entire world, except for North America and Western Europe and Australia and New Zealand, is at medium to high risk for typhoid. Once again, Caribbean, Mexico's in there, those very standard places. So yeah, another very common travel vaccine. Finally, we're going to talk about yellow fever, which is probably like the king of travel vaccines. So this is a viral infection that's transmitted via the bite of an infected mosquito. It is endemic in sub-Saharan Africa and tropical South America. It causes a very serious, like, systemic infection. Does affect the liver, which is why it's called yellow fever. The vaccination, this is one of the few vaccines where there is a legal, like, thing behind it. So there's a requirement for entry for certain countries. So some countries, all travelers must have this vaccine. And this isn't one of those things where you can show them your waiver from Wyoming going, I don't need this vaccine. No, 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 no. You will not be allowed to enter. You probably will be given the choice of get the vaccine or get on a plane back home. These are very, very strict entry requirements. There's also sometimes a requirement for those coming from a country of risk of transmission. This can include airport layovers. This is why looking at that entire itinerary is very important, because someone might be traveling to a country that they might not necessarily need yellow fever, but they had a layover in a country with yellow fever disease, and that layover was 14 hours long. Well, that final country is not going to allow them to enter because they spent more than 12 hours in a country during a layover that has yellow fever. So make sure you're looking at all those pieces of the itinerary. And then outside of the countries that have it as a requirement, there is some countries that have a recommended, you know, like all these vaccines, it's recommended you receive this if you come here. We're not going to turn you around at the border, but it's a smart idea to help. Our routine vaccine available here in the US is YFVax. It's a live attenuated sub-Q vaccine given to those 9 months and older. This vaccine has been unavailable for many years. I think it's been unavailable as long as I've been in this position, which has been 3.5 years. This is because they updated the manufacturing plant and they're now just getting online. The latest expected information I have is in Q2 of 2020, they will be able to have this vaccine available. We'll see how that changes with the current pandemic situation. In the meantime, there was special approval for Stamaril, which is also made by Sanofi for US use. So this is a vaccine that's been used for decades upon decades in Europe. They were just able to give it a US FDA license to use here. This was limited to approved clinics only. So only every state only got so many clinics that could even order and administer this vaccine. We have one clinic here in Wyoming. That is Dr. Babson in Cheyenne. He was our designated Stamaril clinic for Wyoming. Of course, this poses a problem. Cheyenne is not central to anyone. So like if you're in northern Wyoming, you know, you might have to refer to Billings for a Stamaril clinic, or western Wyoming, like the Salt Lake City area. So this can take a little planning and unfortunately might involve that traveler having to travel to get this vaccine. This is a map of where yellow fever is endemic in Africa. The yellow shows the recommended areas. The kind of dark green gray is where vaccination is not generally recommended. And then the light teal is vaccination is not recommended at all. If you have someone that comes to you saying, hey, I'm traveling to Uganda, and you look up Uganda on the CDC travel website, it'll definitely like list out all the specific vaccination requirements. So no need to memorize this map. And then there's South America. Once again, yellow is where vaccination is recommended. The red is where vaccination has been recommended since 2017 because they're experiencing ongoing yellow fever outbreaks. This does include Rio de Janeiro, which is a very popular travel destination. I mean, they hosted the Olympics a couple years ago. And then same thing with the light teal, vaccinations not required. You get areas like Machu Picchu in Peru, vaccination is not recommended for that area, but if they're going on to more of like the jungle areas of Peru, it is recommended. So once again, because they're traveling to Peru, you might actually have to look at the region they're traveling to. This is a table that lists the countries that require proof of yellow fever vaccination. This is something that can change at any time. So I always recommend checking the CDC website or the country's embassy before departure, because this list can definitely change. I know Nigeria didn't always used to be on this list, and now it is. So situations are definitely fluid, but these are countries where you show up at the airport and you better have proof of yellow fever, or you are not going to get to play in Gabon or Ghana or Uganda. No. So you document proof of yellow fever vaccination on an international certificate of vaccination or prophylaxis, also known as a yellow card. These are a standardized certificate across the world that is internationally recognized as being legal. You can't, unfortunately, take a print off of the wire and show up in Nigeria and use that for entry. You need one of these yellow cards. These are great because you don't always just have to put yellow fever on here. You can put all vaccines. It's always good to have proof of all the vaccines you've received. It also has places to list like medications, your eyeglass prescription or contact prescription if you have those. Really great little fold-out card that you can compile all your medical information on for when you travel, and it's recognized as the legal certificate internationally. These certificates become valid for yellow fever 10 days after vaccination. So let's say you get a call and it's like, I'm traveling to Nigeria in 5 days. That's great, but your yellow fever certificate is not going to be valid. It must be 10 days or more for it to be a valid certificate. Once again, implications in last minute travel. You can purchase these yellow card certificates from the US government bookstore. There might be other sources out there, but this is the one I have found. So the logistics of travel vaccines. So we know these vaccines can be pricey. You might not use a bunch of them. What do we do? So first off, but we don't carry them. And I respond, that is okay. You're not required to carry these travel vaccines, especially if you see one person a year that might need yellow fever. I mean, that's just not cost effective to carry yellow fever. The biggest important thing is know where to refer these people to in your region. Sometimes if you're in a border area, this might mean referring to clinics out of state. That's just something that happens here. I mean, we have people who travel into Wyoming for travel medicine. Sometimes we got to travel out. That's okay. If you're unsure of who to refer them to, you can definitely reach out to us at the immunization unit. I will gladly help, find whether it's local or maybe some of like a Stammerell clinic across state lines to help you refer that patient to. But always kind of knowing where to send them. A big logistic is cost. Some providers will have patients prepay for travel vaccines and then order in the doses needed. So they might need Japanese encephalitis. That's great. You pay for it. We'll order it in and let you know when we've received it, and you can come in and get your dose. IPV, we know is pricey because it's in a 10-dose vial, and with having VFC and YVIP, people don't often carry private doses of polio. So this can be a logistic thing. Once again, reach out to the immunization unit. We can help you out, or other providers in your area. And then with insurance reimbursements, typically insurance will not pay for travel associated costs, such as visit fees, vaccines, etc. So this is a cost that patients are going to have to, kind of absorb on their own without insurance. Many clinics also will just flat out not bill insurance for these visits and will require out-of-pocket payment. So definitely something to remember, pass on to your patients and consider. And we'll stop for a quick question slide. The wrap up. So you gotta love these phone calls. I don't know if you get these phone calls, but I get them. It's like, so I leave in 3 days for, yay, last minute travelers. So we know sometimes people have to travel on short notice because of an emergency, and, like a family situation, etc. Or we also know there's some people out there that they had no idea they needed travel vaccines, or they just procrastinate. That's all right. We all procrastinate in our lives. So for routine vaccinations, if they're not up to date, try to provide the first or additional doses of vaccines, making sure you're following minimal ages and intervals. For recommended travel vaccines, for hepatitis A, polio, and meningococcal ACWY, single doses will initiate some protection if the full series cannot be completed. So, they might be fully immune, but they might not. Just making sure, hey, you got 1 dose of vaccine, but still try to take some precautions. Hepatitis B, there is accelerated schedules available for Injurix B and Twinrix. And then there is an adult hepatitis B vaccine called Hepasav B that has a 0 and 1 month dosing schedule, which is a little easier to manage than the 0, 1, and 6 month schedule. For Japanese encephalitis, for travelers who cannot complete the series at least 1 week before travel, they should be counseled to adhere rigorously to mosquito precautions. So mosquito sprays, bed netting, all those precautions. For rabies, those receiving an incomplete series who are then exposed should receive the same treatment as an immunized person. So they shouldn't be considered immune or have any protection from rabies. So for required travel vaccines, for those who might have like a legal mandate around them, yellow fever certificates are valid 10 days after vaccine administration. So unfortunately, it may be necessary to rearrange the order of travel or reschedule the trip. The person can be denied at the border if they have a yellow fever requirement. This can be unfortunate if it's a last minute emergency thing. One tip that you might be able to pass on to people is if they do know they have family members that reside in a country with a requirement, is just to always keep an up to date on their yellow fever vaccines. So if you have family that live in one of these countries, just go ahead, get the yellow fever vaccine, even if you know you're not traveling. And this ensures that if a family emergency or something happens, that you are able to travel back to that area and not have to worry about getting the vaccine last minute and if your certificate will be valid. I know someone personally who does, she keeps up to date on her yellow fever and typhoid and Japanese encephalitis because of the possibility she might have to travel back to her family's home country. So just a tip. For the Hajj in Saudi Arabia, they will not issue visas without proof of receiving meningococcal ACWY vaccine at least 10 days before arriving. So once again, I don't think most people do these religious pilgrimages last minute. It's usually something that is planned for, but remembering that that vaccine needs to be at least 10 days before for Saudi Arabia to issue the visa. And then polio, certain countries do have requirements that departing travelers show proof of polio vaccination if they've been in the country more than 4 weeks. This doesn't necessarily impact last minute travelers because they could technically get that vaccine dose in that country, but it might be a whole lot easier to obtain the vaccine before departing the United States. So finally, we're going to wrap up with some resources. So there is the CDC Travelers Health website. This is cdc.gov/travel. This is going to be your comprehensive up-to-date resource. So they have up-to-date travel advisories and alerts. If you go on there right now, it's pretty much all red and scary and telling you you can't go anywhere in the world. We know there's like level 3 travel restrictions, like Europe and everything. It'll have destination information. So there's drop-down menus. You can select every country and territory in the world, and it will give you the specific recommendations. It's an amazing resource. It tells you the vaccines, medications, other things to consider. This is what I do when I do travel consults, is I immediately go to the website and pull down the country or countries people are visiting. There's a disease directory that'll walk you through all the different diseases, way more than just vaccine preventable. It'll go into the parasitic diseases and then non-vaccine preventable, bacterial, viral, fungal, all sorts of things. There'll be a clinic database on where you can look up yellow fever clinics. There'll be resources for both travelers and clinicians. They change the language, depending on what you are. You can use certain words with clinicians that maybe the general population will understand. And it's also where you can find the online version of the Yellow Book. So the Yellow Book, which is the CDC Health Information for International Travel, is updated every 2 years. And this is the US government's most current travel health guidelines. It's available online on the travel website, but also major online booksellers have it if you prefer a paper version. So this is like the Pink Books travel companion, and it's an amazing resource. Honestly, I use it a lot just for even looking up information on measles, just because great detailed chapters on all the diseases. Amazing resource. Another resource you have is your friendly neighborhood clinical consultant. I promise I'm not always on a glacier in Iceland, but I'm always here to answer questions for both people in clinics, patients, general public, everyone. I do a lot of travel consult calls where people call me and they want to know what vaccines they need and also where they can go to receive it. Like I said, this is like a topic I'm totally passionate about, and I love hearing all the trips people are taking and the things they're doing. And I don't know, I just love travel medicine, so I'm always here to geek out with you about it. So definitely phone, email, and if you're ever in a situation with like a patient and you just don't know where to refer them to or anything, you can definitely give that traveler, that patient, like my phone number and contact information. Totally, I will talk to anybody about their trip. So that one last question slide. Cute little sheep in the West Fjords of Iceland. And then, yeah, I just want to say thank you for listening in. I hope you got some information. Like I said, I know now kind of our lives are suspended, especially with travel. But I think this is a very timely topic because we saw how COVID-19 spread worldwide through international travel. And it kind of reminded us that we're not isolated. We are not, especially Wyoming, we're not an island out by ourselves. We are bordered all around by land. People from Wyoming travel for all sorts of regions all over the world. And, this is a very timely and important topic, and just considering how we can keep our patients and ourselves and everyone safe. So once again, hit me up if you have any questions. Phone or email is great. And yeah, sad I couldn't see you in person this year, but hopefully next year we'll be able to get together for our conference and catch up. But until then, thanks.